Our goal is to involve the patient in the decision-making process, and it can be, we always talk about non-operative care being our primary option. And only when we've exhausted the appropriate non-operative care management options, then we talk about surgical management.
Really, no matter what problem a patient can present, I can always find a partner who has some expertise in whatever problem they have.
Well, we only do what we do best. So if there's a problem that somebody else in this building does better, we get that patient there.
We try to make it so that it's one-stop shopping for patients. So whatever they might need, they can do it while they're here. Whether it's bracing, therapy, MRI, X-ray, surgery, it's all contained in one building.
A goal that I have is to, get patients back to aspects of life they've been missing out on, which is a pretty common theme for a lot of my partners.
New at DMOS in the last year or two is our urgent injury clinic. The reason that's valuable is that if you have an injury and you go to the ER, the chances are you can spend anywhere from 4 to 6 hours trying to get seen. This is a way that you get in, you get treatment right away by one of our PAs. If it can be handled by them, that's perfect and away you go. But if it's a more extensive injury, they at least get those x-rays and that MRI. They call you back and tell you, here's what's going on, here's who you're going to see in clinic.
But some people can't travel. We take care of patients of all ages, but also of all socioeconomic environments. And for someone to drive 60 miles to come up and see us or take a half a day off of work can be not only convenient but hard on them financially. And so for us to be able to go out to the community to see them, it saves them not only time but money. It's more convenient. They like the experience.
The Orthopedic Outpatient Surgery Center, it's an amazing facility committed to the care of orthopedic patients exclusively. So the efficiencies of the facility are amazing. The safety is amazing. The quality of care that we're able to provide there in a very comfortable outpatient setting is really unequaled.
DMOS has been integral in volunteering to take care of some of the high school teams, and we donate our time for sideline coverage for a lot of metro and surrounding schools.
Patients want to know what their options are in this day and age, and I think that's the way it should be, and I think it's just a better experience for the patients to understand the diagnosis, also understand the treatment options.
Whatever is out there, whatever we think we can do to take the next step to kind of stay on the edge of giving people the best care, I think we look for it, we spend money on it, we spend time on it.
We attend national meetings to figure out what is the most efficient way to take care of certain people's problems. Our nurses and our assistants and our techs are top-notch and as skilled as you can get. And it all ends up being a very favorable encounter for the patient.
What I like to see is go to a football game on Friday night and see somebody that I've taken care of competing again. When you've been in practice as long as I have now, you can see kids out all the time getting involved in sports and activities that have had an injury at one time. And that's probably the most rewarding thing to see, is to see them out competing again.
When you come to DMOS, you're going to get the best possible care you can. And whoever you end up working with in our office is an exceptional physician and person. And so they will understand where you're coming from and work towards getting to where you want to be.